Venules and veins do not have thick walls like the arteries. They have thin walls that do not readily maintain their shape. Venules drain the capillary blood and begin the return flow of blood back toward the heart. Venules that initially receive blood from capillaries are called post-capillary venules. As the post-capillary venules move away from capillaries, they acquire one or two layers of circularly arranged smooth muscle cells. These muscular venules have thicker walls across which exchanges with the interstitial fluid can no longer occur. The thin walls of the post-capillary and muscular venules are the most distensible elements of the vascular system. This allows them to expand and serve as excellent reservoirs for accumulating large volumes of blood. Although veins are composed of essentially the same three layers as arteries, the relative thickness of the layers are different. The tunica interna of veins is thinner than that of arteries. The tunica media of veins is much thinner than in arteries, with relatively little smooth muscle and elastic fibers. The tunica externa of veins is the thickest layer and consists of collagen and elastic fibers. Veins lack the internal or external elastic lamina that is also found in arteries. They are distensible enough to adapt to variations in the volume and pressure of blood passing through them, but are not designed to withstand high pressure. The lumen of a vein is larger than that of a comparable artery, and the veins often appear flattened or collapsed when sectioned. The pumping action of the heart is a major factor in moving venous blood back to the heart. The contraction of skeletal muscles in the lower limbs also helps boost venous return to the heart. The average blood pressure in veins is considerably lower than in arteries, and many veins, especially those in the limbs, contain valves. Valves are thin folds of tunica interna that form flap like cusps. The valve cusps project into the lumen, pointing toward the heart. The low blood pressure in veins allows blood returning to the heart to slow and even back up. But the valves aid in venous return by preventing the backflow of blood and forcing blood to only go in one direction. The largest portion of your blood volume at rest, about 64%, is in systemic veins and venules. Systemic arteries and arterioles hold about 13% of the blood volume. Systemic capillaries hold about 7% of the blood volume. Pulmonary blood vessels hold about 9% of the blood volume, and the heart holds about 7% of the blood volume. Because systemic veins and venules contain a large percentage of the blood volume, they function as blood reservoirs from which blood can be diverted quickly if the need arises. For example, during increased muscular activity, the cardiovascular center in the brainstem sends a large number of sympathetic impulses to veins. The result is venoconstriction, constriction of veins, which reduces the volume of blood in reservoirs and allows a greater blood volume to flow to the skeletal muscles where it's needed most. A similar mechanism operates in cases of hemorrhage when blood volume and pressure decrease. In this case, venoconstriction helps counteract the drop in blood pressure. Among the principal blood reservoirs are the veins of the abdominal organs, especially the liver and the spleen, and the veins of the skin. Tables like the one shown here are great resources for distinguishing the features of the different blood vessels.